Medicaid expansion and its alternatives has been a source of intense discussion within AARP. One of my consistent requests on any advocacy issue is the need for hard facts and figures. Those of you that know me, I'm the Joe Friday within AARP. Just the facts, man, just the facts. On the issue of Medicaid, which is an extremely complex issue, we also have to talk about simplicity. Keep it simple so the ordinary individual can understand what we're talking about. That's why today I'm glad to have these maps. These maps point out the important facts about the two alternatives. One of them is cost, so regardless of where you live in Iowa, you can look at the figures of what it will cost you in that particular county. The other is access. Access leads to care. We are honored to have a few speakers who will highlight their concerns, provide important context for these maps, but at the end of the day, I think the maps point out some very significant facts. With that, I will turn it over to our AARP Iowa Associate State Director for Advocacy, Anthony Carroll.
Thank you, Tony, and thank you for explaining the basics of why we are here. With last week's amended House passage of Senate File 296, we are pleased that the Iowa Senate and Iowa House have both affirmed the need for Iowa to offer health care coverage for low-income Iowans. Now the issue is not whether Iowa should offer health care to low-income Iowans, but what is the best plan for providing that care around Iowa. The House and Senate plans have sharp differences. We are here today to reaffirm our support for the Senate plan for Medicaid expansion, and more importantly, to explain why we support the Senate plan and why the House plan is unworkable by comparing the top-line differences between these plans. In short, we are deeply concerned about the higher costs to Iowa taxpayers and the lack of local access in the House plan. While some discussion on the differences between the Senate and House has occurred at the Capitol, Iowans need to see the differences for themselves. This issue has a local impact no matter where you live in Iowa. That's why we created maps to compare the plans and illustrate the cost and access disparity around the state and at the county level. If you look at the cost map, you see that both plans use federal dollars. That's an important point. But you can also see from this map, when you add the federal dollars needed to pay for nearly 60% of Iowans to get coverage, with additional federal dollars needed to pay to subsidize the coverage of Iowans between 100 and 138% of poverty level, the estimated federal cost of the House plan is actually more than the Senate plan. Additionally, the state cost is $17 million more for the House plan. And with that, I'll turn things over to Linda Hinton from the Iowa State Association of Counties to talk about the impact to Iowa counties and the county property taxpayers who fund county services. As I do so, I'll note that 80% of AARP Iowa members own their home, so obviously the use of county property tax dollars is of keen interest to AARP.
Good morning. As Anthony said, I'm Linda Hinton, and I'm the Government Relations Manager with the Iowa State Association of Counties. One of the building blocks of the MHDS, Mental Health Disability Services redesign process for Iowa's mental health and disability system managed by Iowa's counties has been the promise of Medicaid expansion. Medicaid expansion is expected to save somewhere between $27 million and $60 million annually in mental health care costs to an estimated 110 to 180,000 Iowans who would become eligible for Medicaid services. The governor's plan will cover fewer Iowans with fewer services, thus leaving the counties to provide for both the individuals and the services now provided under the Healthy Iowa Plan. In addition to the disparity in the services covered by the two plans, our concerns about the financing can be seen by this map. In short, the financing of Healthy Iowa with $85 million in county property tax dollars is unacceptable. The $43.5 million in mental health levies are already budgeted by counties to fund the mental health system in the coming fiscal year and beyond. By adding $42 million from the Broadlands Hospital property tax levy, the property taxpayers in Polk County bear an inordinate percentage of the funding of the House proposal. Beginning in 1996, the state and the counties have worked together to move the cost of mental health services off of property taxes. There was an agreement at that time that property tax was not the appropriate funding stream for these services. By the same token, they are not an appropriate funding source for statewide health insurance. Iowa's counties are willing to work with both parties, both sides, in coming to a proposal that best meets the health care needs of Iowans in poverty. But we cannot jeopardize the success of the redesigned regional MHDS system by allowing the scooping of local property taxes to fund Healthy Iowa. The success of the redesigned system is dependent on adequate state funding going forward, and taking a third of the property taxes supporting the new system is exactly the wrong thing to do. Medicaid expansion will serve more Iowans than the governor's plan and will not direct local property tax dollars away from their intended purpose. ISAC urges the legislature and the governor to pass Medicaid expansion in order to ensure adequate resources for Iowa's MHDS system, both through the addition of services to those who are currently unserved by Medicaid and by leaving county property taxes in place to fund mandated non-Medicaid services. The additional funds that become available to counties will be used to address rising costs, to reduce or eliminate waiting lists, and to provide the new services required by the redesign. If there is an excess of resources once these needs are met, boards of supervisors will reduce the mental health levy in their counties and provide property tax relief to their constituents. This is a much more appropriate outcome than scooping property tax funds to support a statewide health insurance program. Thank you.
Next, we'll have Dr. Deming from the American Cancer Society Cancer Action Network in Iowa.
Thank you. Good morning. It's an honor to speak here today. As a healthcare provider and a volunteer for the American Cancer Society, access to healthcare is very important to me and my patients. I'm all about personal responsibility and accountability, but if you don't have access to healthcare, accountability and responsibility is really a moot point. This year in Iowa, 17,500 people will be diagnosed with cancer. 17,500, about 47 patients a day. The numbers are startling, but for people without health coverage, the statistics are even worse. People without access to health care are likely to be diagnosed when their cancer is at a later stage, when they're less likely to be cured, and when their treatment is going to be more costly. Fortunately, right now, we have the opportunity to help reduce the burden of cancer in Iowa. Federal funds are available to increase access to health care through the state's Medicaid program. The Senate bill takes advantage of this plan. The Senate plan would make health coverage under Medicaid available to individuals and families up to 138% of the federal poverty level, as visioned by the Affordable Care Act. If Iowa moves forward with this plan, an estimated 100,000 people who currently cannot afford the care they need will have the security of knowing that they have access to proven cancer screenings and treatments in or near where they live. Currently, the House is refusing to accept the full federal package to allow these low-income Iowans increased access through Medicaid. Their plan uses fewer federal dollars and instead shifts the expense onto Iowa taxpayers. The House plan would cover fewer hard-working, low-income Iowans. It also offers fewer locations where patients could have their health care needs met. This serious shortcoming would continue and accentuate the serious access problem that currently exists with Iowa's current plan, Iowa Cares. For thousands of low-income Iowans who lack access to health care coverage, these two plans could be the difference between life and death. As an oncologist, I see the consequences of lack of access to health care every single day. Hard-working individuals with no health insurance who delay seeking medical care for fear of the financial consequences, who delay it so long that what could be a curable cancer becomes an incurable cancer. By the time they seek medical attention, the cancer has often progressed. For me, it's a matter of human dignity and social justice. We can't allow the dual barrier of inadequate access to health insurance and inadequate access to health care to be out of reach for these individuals. Although we can measure these plans in dollars, and we can show that the Senate plan saves Iowa millions of dollars compared to the House plan, a far greater concern for me is the human cost of inadequate access to health care. It's about the patients I see who don't receive health screenings and treatment for early stage cancer because they're afraid of what the diagnosis will cost them. Will they lose their house? Will they have to choose between meals and paying for prescriptions? How will they make those choices? By making the right choices in Iowa and choosing to accept the federal funds as outlined in the Senate plan, we can help eliminate those tough decisions for our most vulnerable population. We can help make sure that everyone can see a doctor regularly, access preventive services such as pap tests, mammogram, and smoking cessation aids, and we can avoid unnecessary visits to the emergency room. It's time, now, for lawmakers to reach a decision on whether to increase Medicaid coverage. If lawmakers continue to delay this decision, the state could lose significant federal funds that could be used to create jobs and improve health care access to our most vulnerable population. The public supports increasing health coverage through Medicaid by accepting the federal dollars, and an increasing number of states have already taken advantage of this opportunity. I urge our legislature to accept Medicaid expansion by using the federal dollars already allocated for Iowa, by increasing health care for low-income individuals and families, and becoming a leader in the fight against cancer. Thank you.